Hello, you are welcome to the part 4 of our lecture series on the primary health care, and we are looking at training and support of primary health care workers. My name is Dr. Isaboyin Henry. I welcome you to today's lecture, and I believe that you've enjoyed the part 1, part 2, part 3. You can access them, and remember, you are free to ask questions. I'll be available to answer them, and make sure you take notes because my discussions are very detailed beyond what you see on the screen. Today we'll be looking at slide 29, titled Support Mechanisms for the Primary Health Care Workers. Now, you remember that we looked at slide 27 and 28 the last time, where we talked about certification and continuous education. And we also learned everything about the training of PhD workers, including case studies. Today, we are discussing the support mechanisms. Now that you have trained them, you have certified them, we need to keep giving them supports in order for them to function properly. Once again, you're welcome. Now, class, let's talk about something really important, and that is support systems for PHC workers, because even the most dedicated health workers can perform well if they don't have the right tools, motivation, or let me put it this way so that you don't get confused. No matter how dedicated the worker will be out there, no matter how serious, dedicated, effective, they can't perform very well. Even if they are highly motivated, they can't perform very well if they don't have the right tools, yes, and motivation, or the mental strength to do their job. Remember, support equals sustainability. Without proper support, even the best training will fade away. Without proper support, even the best training will fade away. And so, they are provided with number 1, operational support. And number 2, they need psychological and professional development support. When we say operational support, let's start with the basics. That is the tools and logistics that help the PHC workers function effectively. And the first of them is medical supplies and equipment. PHC workers need consistent access to essential drugs, vaccine, diagnostic kits, protective equipment. When these are missing, it's like asking a soldier to fight without weapons. And studies have shown that adequate supply chains significantly boost the PHC workers' performance and also the trust from the patient. Number 2 is communication tools. You are sending somebody to a rural area and needs to communicate with the urban, the headquarters, or the PHC, far away from that rural area. Tools like mobile phones, radios, and digital tablets have seen to help the PHC workers coordinate with their supervisors, report their health data, and mobilize communities quickly, especially in emergencies. We also see transportation support. In rural areas, many PHC workers travel long distances on rough terrain to reach remote families. And therefore, providing transportation allowances like bicycles also and motorcycles will ensure that the outreach activities continue smoothly. For example, in Nigeria's CHIPS program, transport stipends are included to improve mobility and coverage. And so you see that operational support helps PHC workers reach people, communicate effectively, and also deliver timely care. Let's look at psychological and professional development support. But hold on, let's not forget the human side of health work. Because sometimes the work, we forget that humans do these things and we just want results. The PHC workers are often the first responders to sickness. They are first responders to poverty and even death in their communities. Without emotional and professional support, they can easily get burnout. And so they need counseling and mental health support. Counseling and mental health support. You see, providing access to counseling or peer support groups will help the PHC workers manage emotional stress. And you need to help them with regular debriefing sessions so that it can make a huge difference in terms of their morale and their resilience as well. You need to invite them from time to time as a supervisor and ask them questions. How is the field? What has happened recently? Oh, we learned somebody died. What really happened? I hope you're not blaming yourself and all that, because sometimes it weighs on them and it can affect their psychology. And so you need that regular debriefing session, because we've seen that it has made huge difference in their morale and resilience. Another one is skill enhancement workshops. You see, ongoing workshops, mentorship programs, and refresher trainings keeps the PHC worker confident and up to date. It's not just about learning new things. It's about staying motivated and feeling valued. And so what's the big picture? When PHC workers are supported, both physically and emotionally, they stay longer on the job. They perform better and they deliver higher quality care to the community. That's it. When these workers are supported, both physically and emotionally, you see them very, very vibrant. Stay longer on the job. This jackpot syndrome, you won't find that. Because they love the job, they're enjoying the job, they are getting what they need to be able to thrive, they perform better, and they deliver high quality care to the community. And so as a key takeaway, supporting PHC workers isn't just an act of kindness. No, it's not like you're doing them a favor. It's a strategic investment in the success of primary health care. It's a strategic investment in ensuring that the long-term project is kept focused, intact, and so that it can deliver the required output on the long run. If we want stronger health systems, we must start by strengthening the people who keep them running. If you look at this slide, it talks about the dimension. You can see from dimension 1, logistic support, dimension 2, emotional support, and dimension 3, you have the professional support. This is very key. These 3 levels of primary dimensions are key. They must be ensured that the primary health care workers have access to them. Logistical support, emotional support, and professional support. We look at slide 31 now. Let's break down these 3 major types of supports every primary health care worker needs to stay effectively. Now, we looked at the logistical support, emotional, and recognition support. Now, because I want you to remember this, even the most compassionate PHC worker, like I told you, cannot thrive on motivation alone. They need structure, they need resources, and they need encouragement. And so when you say logistical support, number 1, logistical support, the foundation is this very logistic support. And this is the backbone of effective community health work. Without logistics, even the most dedicated PHC worker will struggle to reach people or deliver care. When we say logistics support, they need medical supplies, like I've said earlier. So PHC workers must have ready access to medicine, first aid kits, diagnostic materials. Imagine a community health worker visiting a sick child but having no drugs to give. The community will wonder, what are you doing here? It will reduce the community trust and the worker confidence. Transportation, we've talked about it. Because many PHC workers operate in hard-to-reach areas, villages separated by rivers or forests. So providing motorbikes, bicycle, or transport stipends ensure they can reach everyone, not just those near the facility. I've talked about the communication tool as well. Radios, mobile phone, tablets are very key for coordination, to give an emergency alert and also head data reporting. And so it is important that these things are provided. So logistic support gives the PHC workers the tools to deliver care and the means to move and the ability to communicate effectively. Number two, let's look at the emotional support. This is the human side. PHC workers deal with, emotions too. And the emotions in this case can be very heavy. Yes. Issues of child death, that's a heavy emotional situation. Poverty, you see stark poverty. These people can't afford drugs. Even the least, laboratory investigations, they can't afford. Poverty. It weighs on these PHC workers because they can't help the situation. How about community resistance? They bring something good, but the community is resisting it. And they know this community needs it. This can emotionally weigh on the PHC workers. And in most cases, you find out that there are no backup. So you see, mental and emotional support are just as vital as physical tools. And that's where counseling services come in. So offering mental health counseling or stress management sessions will help prevent burnout and emotional fatigue. And this has been shown to increase retention and performance among the community health workers. Also, they need peer support groups. So counseling service will help to deal with emotional support and peer support groups, because regular meetings of the PHC workers is important to help them share experiences in their different places, share the challenges, what are the small wins, so that they can build solidarity. Always remember that emotional support have helped PHC workers stay resilient, and it has helped them continue to serve their communities with compassion and energy. Number three is recognition and motivation programs. Recognition programs such like celebrating outstanding PHC workers, even with certificates, public mention, or small rewards, it goes a long way. You recognize them. You bring a get-together and you give certificates to them. Those who are not doing well will be motivated, and those who are doing well will be motivated. It communicates value. It brings respect. It motivates them to improve. Countries like Ethiopia and Ghana, they've shown that community recognition ceremonies, even in Nigeria, and it has improved retention and moral, spike in terms of positive vibe among frontline health workers. And so the point here is that the PHC workers love to thrive. And if they must thrive, we must support them holistically by meeting their logistical needs, protecting their mental health, and appreciating their hard work. So when PHC workers are supported, communities stay healthy, and primary health care becomes stronger and more sustainable. At this juncture, I'd like to conclude this aspect by looking at slide 32. In this place, we see that professional support is also key. And that is the last part in terms of support mechanism. And you can provide professional support by providing ongoing training, and that's about continuous education opportunities that keep them vibrant, updated for best practices. Number two, supervision and mentorship. You establish a system where there is experienced health professionals guiding and supporting the primary health care workers, not just leaving them on their own. Number three, you also provide career advancement opportunities. That way they keep growing, they keep making progress and not stagnant for many years. Just provide a way that psychologically they know that I can grow, I can be promoted, and not just becoming stagnant for 10, 20, 30 years. These layers collectively ensure that the PHC workers are well equipped, motivated, and also they are capable of delivering effective health care services within that community. And a good example is what happened in Liberia's Ebola response. We had support groups, and this support group helped to reduce the psychological stress for PHC workers during the Ebola outbreak. So this is very, very important. And so in our next videos, we'll be looking at the challenges faced by the PHC workers. I believe that you've enjoyed this video. And if you did, why not? You can like the video, share with your friends, subscribe if you have not subscribed. Thank you. I'll see you in the next video. My name is Dr. Aishaboyin Henry. Thank you.